Myself, Dr. Anu Rajesh, welcome you all to the afternoon session of the theme Improving Education, Practice and Research. I invite Dr. George Matthew, Associate Professor, Department of Materia Medica at Nehru Homeopathic Medical College and Hospital, Delhi, to chair the session. Welcome, Dr. George.
Thank you.
May I now invite our first speaker, Professor Manoj Patel, sir, to present a study using multimedia for enhancing observation skills during homeopathic case taking. Over to you, sir.
Thank you very much. And it's my pleasure. I think I'm visible and audible both.
Yes, sir.
Lovely. And all my fellow panelists, chairmen, it's very interesting study on educational technology. This is a very close subject to me of teaching and learning methodology. Medical Educational Technology, MUHS, has invited us to do this project. And I have done it at my institute, Dr. M.L. Davde Memorial Homeopathic Institute, along with my co-authors, Dr. Devangini Broker and Dr. Kumar Davde. Friends, it's very interesting time, and all of us as a homeopath, which we look forward to homeopath, which is more evolved, sensible, insightful, very empathetic homeopathic physician, and who is prepared for research. And it's my pleasure that I was lucky that I'm part of this institution, which invests a lot in training of the physician. And now I am part of a training team. So it's very interesting to see that Hahnemann has emphasized on unprejudiced observer. And this is really required for our research, required for development of homeopathy, and not only that, day-to-day practice also. But how to teach them in classroom setup is the biggest challenge. So I'm going to present these dimensions of how to achieve this goal and divided into a small curriculum-based study. So if you see in 83, aphorism number 6 and 84, nothing but freedom from prejudices and sound senses, attention in observation, fidelity in tracing picture of the disease. That's what Hahnemann asked from physician. MLD sir has taught some of the methods of observer training. So I have implemented that in a larger classroom. What I have learned in OPD, can I be taking it to classroom? And this is the challenge of today's time, that how to teach this subject in a classroom setup, how to teach this subject using clinical setup and making both dynamics available to all students. And in Indian circumstances, the classrooms are full of 100 students, 50, more than 50 students. So this experiment, I have done it with the 30 students. Definitely it can be taken up into the large scale. Let's see what is the finding. Very interesting study, very energetically involved study of each student when it comes to multimedia use. So an innovative study including multimedia use in curriculum with aims to improve competency of observation and documentation. Creating structured curriculum of case-based learning in enhancing this was my primary objective, and follow it with understanding all doctor-patient communication and then internal reflections also, what I go through when I see case. So experiencing this self-directed learning goal so that each such session students are ready to take up in OPD and learn by themselves. So this is a big objective, but it's very interesting. So method, implemented this in 4 stages, in 5 sessions over a period of 2.5 months. In between the phases, students were supposed to practice in OPD. Their supervisors used to report us what are the changes they find in student. So they were first session started with their assessment with gross observation. Where do they stand? When one interview was being run to them and they could see something, they could so many things they missed out. So they noted down how many things they have grossly missed. So first session started with gross observation. Then we have shown them pictures, photograph. We have used, as session progress, we have used the dimensions of multimedia from starting from plain photograph. Then we have taken up videos from YouTube videos. from videos taken of the patient. Then we have taken up enacting of patient doctor by physician, and then finally evaluation report written by them to see what changes they see within themselves, what are the obstructions which they say.
Sorry to intervene, Dr. Manoj.
Yeah.
Your slides are not moving. Can you click on the slides or show it in the slideshow mode?
Sorry. Now you see my slide?
Yes. Now
Do
it
you
is
see
visible.
this is moving?
It is moving now.
Okay, fine. I'll go this way. Is it okay with you?
It is okay, sir.
Yeah, because I don't want you to miss out on slide. This is very important slide that previously I missed on this. Implementing method. So gross observational method, interview processes method, how interview is progressing, how they are able to see various progress of time dimensions, cross communication to finer communications, various intricacies of interview processes, and what they see within themselves, various changes which they are observing when they see some emotional situation. So very, very powerful experience they have gone through. Best part was 100% attention, 100% attendance of all the students. So method of conducting 5 sessions, step of case-based learning was taken. So what they see in clinic, what they observe in clinic, from there it was taken up. Then stage was further progressed into more complex aspect of communication. Then it was further progressed into understanding themselves through evaluation meetings. And Wisconsin's match method, which is most reliable statistical way to understand the changes, was used. Method of assessment is very important. Baseline assessment of observation was done in the first session. What they find themselves after the session, what changes they observe within themselves, and then peer review. Peer sees what change they see in their other colleagues. So it was a very involved method. And after this, they go to OPD. And in OPD, what they are able to see changes in themselves was also assessed. So this is how 4 competencies of observations, which competency of gross observation, competency of observation of interview processes, competency of internal intricacies of doctor-patient relationships, and then finally inside them, intra-communication. So all the 4 competencies, see the result, very interesting result. Competency of gross observations like what we have seen, time, punctuality, appearance, conduct of patient, how their gait, language, tone, speed, and you can understand all this has value in homeopathic case taking, rubrics, symptoms, analysis, and clinical conditions. So they have seen an improvement, which you say blue was their original state, red is after the session. Competency of observation of interview processes, which they have seen. How the various interview turn takes place, what time physician takes in chief complaint, how they go into exploration of mind, how they go into exploration of pathology and clinical conditions. So the whole timeline and the process of timeline observation, which is so fast moving observation, it's not static. So they are able to grasp things. So the improvement which you see from blue to red. Then you see competency of intricacies of the interview processes. What happens between doctor-patient relationship, which is very key to homeopathic practice. The empathy, exchange of various views. Sometimes physicians themselves have some blocks. So are they able to see this as an observer? So this Hahnemann has enhanced this, that observer is the key to homeopathic prescribing. And these observations which they could improve from, you see, blue to green, some of there are 200% improvement. Like you see 21 to 56, 14 to 45. These are the level of changes which we could see over a period of 2.5 months. It is not just one day. Competency of observing one's own process. This was a very dynamic interview which we situation taken. My mentor, Dr. Anil Tiwari, was there. He's a very senior most homeopath and teacher of all. And he was also witness to this session, that how students could see themselves, that what are their internal blocks, what are the blocks which within themselves, emotional blocks, intellectual blocks, which comes up in perceiving and observation. So this has created a huge gap within themselves they could see, and they wanted to bridge this gap, and the learning became more dynamic, their involvement become more interesting. And then final result. The result is very interesting. You see Wisconsin's with 0.01 significant result, which we are able to see. The training module have shown significant difference of gross observational status. So we could see a massive changes in some of the session from 2 to 13, 2 to 16, 5 to 17, and 14 to 38. These are all average of class. Somewhere it was less, somewhere it was more. So conclusion, innovative use of multimedia in classroom has succeeded in improving observational skill of PG student. This project can be successfully expanded to large classrooms, specifically undergraduate and interns. Each colleges, this is possible. It's an era of multimedia. Students are using this. And if teacher starts taking use of this multimedia in more creative way, I think our next generation homeopaths will come up with far more better abilities rather than hyperkinesia, which we see that they miss out on gross, lot of observations and various needed observations. And finally, if you want to evolve, it starts from education. Unless and until educational method improves, quality of researchist in homeopathy is not possible. And this observation training was with this intention that if we can improve this stability of observation in all our homeopathic fraternity, we will be doing great service to homeopathy. Thank you very much to LMHI, my PG students who have participated actively in this entire process, my teachers who have been supervising into various OPDs, MET, they have given us an opportunity, and visionary Jawahar Shah who has the ambition to see that 5,000 good quality homeopathy he wants to produce. So he all the time supports us for this. I hope I was in time to finish this. Thank you very much.
Thank you, Professor Manoj, for a wonderful presentation. I invite Dr. Josh Matthew to give us expert comments.
Thank you, sir, for your visionary insights into the case-based learning process and observational skills development for the PG students. So it's a really interesting and very new field, I think, in homeopathy, which is coming up, especially that is of essential importance also. A few questions to you. Like when we look across India, we have a lot of colleges doing PG. And like all the colleges may not be having the same educational infrastructure or education technology to cater to such a type of training which you have mentioned. So how, like if you are going to a very rural place where you don't have such a process involving multimedia and the use of multimedia in implementing this type of case-based learning, so how will you approach this in a
I think rather
looking at colleges all over India? So
yes, sir, and I will say that my college is also in a rural setup where there was a lot of internet issues.
Yes.
So there was no question. And today's time, with thanks to India, specifically in our Indian circumstances, even smallest village has now YouTube assessment. So media has reached everywhere. Media is in every student's hand now. Now it's a question of professors. They have to be equipping themselves to be part of the media. Like you will not believe, one of the very good quality of testing of observations are available on YouTube. I had very little time, so I could not show you what I have done. But it was so interesting that there are a lot of tests available on YouTube itself of challenging your observational skills. If you open up and student can see how the moment they miss out so many important observations, and then they give the result of the test that there were 55 observations and you have seen only 5. So this gap itself produced so much of attention in them, which Hanuman is asking for. And this is, I tell you, it is possible in the remotest village now, remotest. And not only that, material which we have generated, we have kept it open for all, that people can learn from this. I am available on webinar also for this, because see, this is the platform which should go to everywhere, every colleges, not only PG. I feel that UG and interns, because PG is the second level, UG and intern level students should be involved in these processes. Second important thing, we have to teach case-based learning to students. You can't take them so many students to OPD. There are 5-6 patients in OPD sometime in some colleges. But if you have multimedia with you, you have documented case in video, we have preserved that on your simple mobile. I have teach cases from mobile only, mobile level of observation. Okay, this is possible. And then they take this to classroom with the permission of patient for a restricted use. And I tell you, if a teacher who is busy in OPD can teach gradually, like we call it net practice in cricket, where slicing. I take 5 minutes video for 3 hours. You will be surprised that I split 5 minutes into 3 hours of my lecture. And no one goes for even tea break.
So
Guaranteed.
one question which arises from this is like, this is a very intensive process. What you have mentioned is a very intensive thing, investing a lot of time and energy. So like when you suppose you have an OPD with 250 patients, so how do you like take this into account when you are considering an OPD?
Rather, I will say OPD 250 you manage as in the speed which is required. But out of 250, select 5 patients, select 5 students, let them document and let them recreate this case in classroom, which is 1.5 hours now. 1 hour, 2 classrooms together or a tutorial. I tell you, everywhere there is time. I go to UG college and show them, demonstrate them. This is possible. And I tell you, no student go out of room. Yesterday I took session for 2 hours. There was no break and no one asked for a break. And then they wanted 1 more hour. So I was there with them from 2:30 to 10:30 with small break of 10 minutes. So this is their topic. This is their interest. And we as a teacher have to come out of this rigid classroom structure to a time dimension which is with student, right? And use them only. I don't think so teacher has to. I have done dramatics with students. Like they will come with a script. Patient, it may not be accurate like that as what is seen in OPD. But then they do drama. One becomes patient, another becomes doctor, and then they run through the whole process. And the whole class observes. It's so engrossing, I tell you. Even all teacher comes and sit in this classroom. Because everyone has so much things to talk. So many things they have observed. And this observation, when collectively put together, it becomes almost around 50-20, 50-60. And everyone I asked, how many you seen? They said 10. I said that 60 observation means there is a big gap. How do you bridge this now? So then they scratch their head that how to put themselves into an attention. So I have to tell people that if given to me each college, I'll just go for teaching 3 aphorisms, 6, 83 and 84. And you see what happens to homeopaths. OPD will change with their quality observation.
It's a very novel method, I think.
And I'm lucky that Ashwada sir is with us today in this listening, and he has seen by himself personally, and he knows that it is possible. Sir, namaste.
Thank you, Dr. Josh and Dr. Manoj, for a wonderful discussion. Now I invite our next speaker, Professor Ishwar Das sir, to present a study on the hidden treasures in homeopathy and future healthcare technologies. Over to you, sir.
My presentation is visible?
It is visible, sir.
Okay, thank you so much. Thank you so much, Dr. Matthews and Dr. Anuja. And thank you for Dr. Manoj, who made a presentation. You know, he's a very dangerous teacher. If you ask a question, he will continue for 3 hours because he was a student of Dr. Dhavale and Dr. Kasa, Dr. Karnad. Anyway, thank you, Dr. Manoj, and be with me for this presentation also. Actually, I'll be talking something about hidden treasures in homeopathy, the future of healthcare technologies. I requested for 20 minutes. I don't know whether it has been allotted to me or not. 15 minutes is too short a time. But anyway, I'll try to...
Sorry, sir. It is 15 minutes.
Yeah.
Okay. I'll skip some of this and go.
So just to interrupt you, sorry. Actually, you can put it on the presentation.
Yeah, I put it.
Thank you, sir.
Now, these are the 4 cornerstones of healthcare system, every healthcare system, whether it is allopathy, homeopathy, Ayurveda. There is a medical education part, there is a medical research, drug development, and healthcare technologies. And unless these 4 are properly attended and integrated together, the system will not develop much. In every system, innovation is inevitable to development, and every innovations are intrinsic to that system. Now, on this scientific versus unscientific in medicine, every medical system has evolved from different philosophies and civilizations and culture. To understand the science of a medical system, one has to understand the traditions from which it got codified. Those who understand this logic shall accept that science of their system, and those who are not acquainted with that shall perceive it to be redundant. Those who know the Indian philosophy of Tridorsha theory, they will accept the Indian traditional system. Those who believe in vitalism will accept homeopathy as a refined medical system. Debate as to what is science in medicine continues to be among the academia without much significant impact on its public acceptance. In fact, it is the time of analysis and not the approaches that make one medical system more scientific or unscientific. Science versus dogma in medicine. Science called for rational explanation. We know the knowledge in a medical system, any medical system, is contemporary. That is, if the knowledge in a medical system is not contemporary, that will be labeled as scientific. If not, it is perceived to be unscientific. One medical system supposedly is more scientific could explain its logical parts of that time. So what I mean to say is science, the time determines science. Health science is dynamic and changes with time. Models of atoms, theories of nature of life, and genomics, everything has changed over a period of time. Different medical paradigms as we are having now are, one is the biomedicine, which is based on biological, that believes that all the diseases are caused because of the biological causes, and therefore they direct that such diseases to be treated with biologically or pharmacologically active substances that rely only on experimental evidences. Holistic medicine believes that natural diseases are due to life force, changes in the life force, and it partly rely on partly believe on medical philosophy, science, as well as art. Therefore, it is based on experimental as well as experienced evidences. Because of these two distinct factors, the research perspective should also be different. Homeopathy, as we know, these are all important things. The largest medical system is greatly misunderstood. I need not explain because I will skip up this because of the time constraints. In short, homeopathic strength is more in less or less in more. Safe medicine, green medicine, holistic medicine. It's better for long-term diseases. It has constitutional approaches. Classification of diseases of Hahnemann is one of the most exemplary classification of diseases. Miasmatic approaches. It is nanomedicine, personalized medicine, precision medicine. These are most of the adjectives and importance given by homeopaths to homeopathy. Many of them are true, but these are not accepted by the conventional science. There are extensive clinical evidences, but the reliability of homeopathy is being questioned. Historically, why it happened is when homeopathy got popular, the focus was more on creating more therapeutic domain by proving and introducing more medicine, and the focus was not much on the scientific aspects. Gradually, science of homeopathy got redundant before the ever-growing technological reformation. When questions raised on the basis of science, a blind race started to investigate every concept with the same yardstick of reductionist science, more to satisfy our protagonist rather than creating or understanding the homeopathy much better. This is exactly what happened homeopathy where stands today. Thus, convincing someone who doesn't want to see the truth of homeopathy has become the priority of homeopathic research in many places. Need to explain the principles with science that we can do now. I put the whole principles in this perspective. Homeopathic, if you look into this, the similia similibus current is the main concept that on which we stand. Hahnemann has fortified this concept with the main three crucial things: the drug proving, drug dynamization, and individualization, and he created ancillary principles to make it a holistic, complete medical system. Basically, what is happening in homeopathy is there is a lot of clinical evidences, but there is very less on fundamental aspects. The clinical evidences through applied research without substantial evidences on fundamental research is found to be perceived to be unscientific. This is exactly the problem where homeopathy is faced. We have all clinical evidences, but how it acts, why it acts, where it acts, we are not able to explain it. Drug dynamization is the most important crucial principles, and possibly it is the lifeline of the system. As the process of drug dynamization takes away the material substances beyond the conventional physical paradigm, it is supposed to be a greatest fallacy of the practice. This is a contention issue with the material science. I'll touch upon some of the major scientific evidences that has happened on material science during what happening in the drug dynamization. One is the water memory theory. Second is the structure of water. Third is the xenobiotic theory. And the fourth is nanoparticle theory. I'll explain a little more in subsequent slides. Jacques Benveniste is the top French biochemist who has brought out this water memory theory for the first time. In 1988, he published a paper in Nature describing the action of very high dilutions of immunoglobulin antibody on degranulation of basophils findings, which seemingly close to the homeopathic concept. This was published, and a lot of hue and cry came, and the Nature was forced to withdraw this article. But still, it's the concept continues. Second, who continued with the theory on water memory is Jean-Luc Montagnier, a French virologist, still living legend, and he was a Nobel laureate. He also proved that water can carry the memory, and homeopathic principles are close to what he has described. There are a lot of articles on this, and a lot of explanations are possible, because that is why I told you, you can give me some more time, I will explain all this much better. The third was the water structure concept. Water structure, water concept, water memory, and water structure. Professor Rustam Roy, he was an Indian he was a physicist born in India and who was working in Pennsylvania University and was the leader of material research. He brought that it is the structure that matters more rather than the composition. Water is combination everywhere, whereas he told that the structure of water, as it changes, water can also modify. For a simple example, he suggested was graphite is also a carbon compound and diamond is also a carbon compound, where both of these having extremely different properties. The third theory proposed was Dr. R.R. Sharma, Rathiram Sharma, Professor, Department of Biophysics and PGI Chandigarh. He published a lot of articles and he concluded that homeopathic medicines are xenobiotics. These articles are all available. The fourth one, nanoparticle theory, created by Dr. Bellare. He has already presented here. Dr. Rajendran has successfully articulated the theory of homeopathy with nanoparticle. Professor Anisur Rahman also supported this theory, and lot of researchers are working on the nanoparticle theory now. The fifth one is the quantum principles, proposed by Professor Amit Goswami. Amit Goswami was a quantum physicist, and he was a leading person working on a lot of concepts on contemporary, complementary medicine like Chinese medicine, homeopathy, acupuncture, and he wanted to have an integrated approach. And his concepts are not accepted even in his science, but he's a great supporter of homeopathy. So now at least we have 5 concepts on homeopathy and drug dynamics. Coming to individualization, the next crucial principle, it is getting a lot of acceptance as personal medicine or diagnostics, and it is all linked with human genomics. The drug proving is already accepted. Ultra high potencies, drug dynamization. I have told 5 principles are there. One is biological, one is physical, one is chemical, one is xenobiotic theory. 5 principles are there. Drug proving is there. Individualization. These are all the scientific basis of homeopathy. If we separated this and put a lot of stress on research on these things, we will be able to make it more scientific. The artistic approach of health I'll skip up this, and homeopathy is future of homeopathy is personalized medicine, immunotherapy, preventive health, promotive health, It is very good for behavioral problems, drug care, de-addiction, pediatric care, postnatal health, hormonal disorders, podiatry, viral infection, allergic, orthopedics, homeopathy in agri-care, veterinary care. These are having tremendous potentials on homeopathy. Now, the way forward for us is what is happening with this? Our education system is overloaded with the art and philosophy of homeopathy. Very less important is given to scientific aspects of homeopathy. Now we make the 7 principles of homeopathy and focus on the 3 aspects which are researchable. One is through human genomics on individualization. Second is on drug proving, how it happens, how the symptoms are deriving on drug proving. On the basis of scientific evidences, we have to bring it. And the drug dynamization theories. Drug dynamization also, a lot of fallacies are there. There are centesimal scale, decimal scale, potence, the 50 millisimal scale. Again, there are fallacies that the Hahnemannian method, the Kosokovian method, all these methods are to be standardized, whether we need different scales or whether we need hand strokes or we want a vibratory method or stroke method. All these have to be scientifically brought in, because now the technology is available to see the changes happening in every stroke or every vibrations. We have to standardize this and make it more scientific to make homeopathy more acceptable and scientific. The science, art, and philosophy. We can't have any medical system with purely based on science. Reductionist science as is there in the modern medicine. The modern science, the biomedicine, which rely mostly on the purely on scientific aspects, has also its limitation. The medicine mostly relied on philosophy and art also having its limitation. A judicious combination of science, art, and philosophy is the combination which makes a system more holistic and more relevant. That is going to be the future of healthcare delivery system, and that is a system which will be more humane, more judicious, and more valid. And we have seen that homeopathy has tremendous potential on several areas. And if we make more clinical evidences without support of the fundamental research or the basic research, then still we continue to be in dark. We want to become from the second largest system to the first largest system, or at least to preserve the status of the second largest system in future. We have to put a lot of efforts on the 4 crucial principles to make scientific evidences. What is there in drug dynamization? What is there? How the individualization and personal medicines linked with the genomics and theranostics? We have to bring that, and the biology of drug proving, the pathology of pathogenesis of drug proving, all to be explained. These are possible with the effort of the modern science. You will be able to explain it. And that is a gist I want to make it here. And the fundings are available. Fundings are available from different sources. The last slide is the gist in history of medicine. Is the father of medicine, the father of modern medicine. Early 2016, Medscape, the newsletter of American Medical Association, featured a series of articles entitled 50 most influential physicians in the history. Sadly, Dr. Hahnemann's name was in the year. William Osler was adjusted as the first. Osler was well aware about the important contribution that homeopathy made to the practice of medicine and spoke frequently about it. The twist of the story is the words of Osler itself. No one individual has done more good to the medical profession than Dr. Hahnemann. So thank you very much. I tried to run and adjust with the time. I'm not very happy what I have told about it, but you have put my hands and legs tied up, so I was to force it with skipping certain part and effectively not making it my points. But thank you very much anyway for giving this opportunity. Thank you, LMHI. Thank you for all. Any questions, please, for 2 minutes?
Thank you, Professor Ishwardas, for the wonderful presentation. Dr. George, please, your comments.
So I saw your last slide. So even before seeing your last slide, what I wanted to talk was about Osler, William Osler. He was a big supporter of homeopathy and he acknowledged Hahnemann very much. But some one or two observations in recent years which we can share regarding this. One is like when we are reading, like we have all studied Hutchinson's clinical methods. So earlier when we were students, it was an entirely different edition. Now the latest edition, if you go through, the first chapter on case taking is purely homeopathy. If you read it, it is what Hahnemann has told. So I think the gap between allopathic case taking and homeopathic case taking are almost gone, because now, like when I teach my students, I tell them to read from Hutchinson's chapter 1 and then read organon. So if you can see a very clear parallel. Earlier we used to say that this is entirely different. Case taking allopathic is different, homeopathic is different. Now the holistic concept has come into Hutchinson. First chapter, if you go through, that is very clear. I think that is something which is a difference from the earlier era. Like when we were students, definitely it was different, but now it is changed. And now allopathy is going into, because I think they have found out that unless you go into personalized medicine, you cannot remain in the system. So that is why they have seen. And another thing which I saw is like we have fundamental research on one hand and we have clinical application of homeopathy on the other hand. So there is a gap between this which has to be bridged, because we say a lot of things on fundamental research, and whether this will reflect in your clinical application of homeopathy, that is always a question. How you apply the knowledge gained from fundamental research into clinical application in homeopathy. That is another thing. And another thing which you told about like introducing the action of homeopathic medicine, the study of action of homeopathic medicine on the undergraduate level, I'm a little not sure, because I think on the undergraduate level, we can just mention about nanomedicine and other things. But I think on the PG level and on the PhD level, definitely the students have to go into detail and take this up as a research projects in detail. But UG level means I don't think they may have the basic understanding and the like technical know-how to go much into the deeper thing. But this was a very interesting presentation. Thank you, sir.
Thank you. Thank you. No, it's why my intention was not to say that undergraduate education, we need to have everything. The problem is science-based students, when they come to homeopathic education, we are completely taking them away from the science. They come with a physics background, they come with a biology background, and homeopathy we are not teaching. At least keep continuity of education on science, so their interest in science will continue.
Yes.
Otherwise, when they reach this post-graduation, they simply forget everything. So some sort of a human, something about the physics, something about the nanomedicine, something about quantum physics, we have to put it in undergraduate instead of having a lot of philosophical teaching. Thank you so much, Dr. Matthews, and thank you very much, all the panelists.
Thank you, sir. I invite our next speaker, Dr. Simonas from Lithuania, to present a study on ultimate experience in homeopathy by discovering its hidden half. Welcome.
Okay. Hello.
Hello.
Do you hear me?
Yes, you're audible.
Yeah. Okay. Okay. I'll share my screen. So again, greetings from Lithuania. I'll try to share my my homeopathic journey and some peculiar transformation that it brought into the practice and learning. Okay. Yes. We may adore the classical homeopathy, or we may say that it is ahead of its time, but actually homeopathy is present. It's what we can experience now, and we can experience homeopathy through what my teachers called listening. So listening is becoming aware of sensations, including the most subtle ones. It's about causal level or life events, levels of stillness that are just the opposite to sensations. And also, if we listen from whenever we are with the capital L, and we use attention to listen, not focusing one's intention on the part, we may perceive the totality. Totality may become experience. And also, when we use the yang counterpart of listening, it's like testing techniques, bioresonance techniques, we may teach listening and we may learn it, we may practice it, we may train it. Also, we used a interdisciplinary approach, which is about using many different remedies, many different approaches, and with listening, they become sensations. But they are felt very differently, and they introduce us into new kinds of sensations, into proving experiences that we've never imagined they are possible with homeopathic remedies, with classical ones. And such homeopathy discovers its siblings, and they become one family. So it's not isolated anymore. It's sharing with its holistic colleagues. And it's about finding many answers and also getting the access to the very roots. And also understanding something about the remedies, understanding that potency is actually about potential. So if we look into the dictionary, we look for dynamis, which was the word Hahnemann used pretty often. We see that it's just the opposite to energy. And potentiality is the ability to develop or come into existence. So actually, information appears not working, and information does not cause or add anything new. It reveals what's already here, but is hidden, forgotten, or maybe not yet manifested. So it may become a solution of a problem, or point to the causes that lies underneath, or just about realizing one's potential, and that would be health if we speak about our patients. And that gradual transition from active substance to dynamized and potentiated remedies, it took more than 40 years for the classical masters, starting with Hahnemann, and it resulted that no one saw the radical difference between causing and revealing. Today we have kind of two sides of homeopathy. The one you know best, and that's good old classics. It's symptomatic, it's pretty evident and even scientific. And it needs no theories, actually, because it just works in practice. And there was also the another side, the chronic side. And chronic side was what was a problem for the early masters. And Hahnemann himself, okay, we'll take. And Hahnemann said that actually their beginning was promising, the continuation less favorable, and the outcome hopeless, when they tried to use this acute manifested side on the chronic diseases. So the question is, if there is any radical and simple solution, and what would be the opposite to classical prescribing? Like what is the yin counterpart of classical prescribing? And how can we return to the very roots of homeopathy instead of inventing something new? Actually, the key is improvings performed live during the consultation. So the whole picture would look like this. And here on the left side, we see this big white yan. It's like totality of symptoms that is pretty obvious. It is easy to apply similar remedies that relieve the symptoms. It's pretty evident. And there is also that little optional deep dark well of yin in that yan side that stands for the hidden part of totality. It represents causes of acute illnesses that may be revealed by remedies when used in a proving mode, so-called. So nosodes or organ remedies or Bach flowers or other remedies may be important for prophylaxis of relapses here. But then we have that chronic yin side, which is pretty big, that we can't see the totality, as most of it is hidden in that depths of the ocean. So what we see is this tip of the iceberg that represents the vague manifestations. So the symptoms here in the chronic cases, they are not so essential. And remedies like small remedies or even formulas may help to relieve the suffering, may be used for prophylaxis of exacerbation like drainage remedies. But when dealing with this ocean, we may use the remedies in what we call proving mode. We can just experience provings with our patients during consultation. These provings, natural provings, should happen spontaneously. Imagine proving of an exhibition instead of proving of a particular painting. So when testing, we go through the whole set of remedies, like we go around all the exhibition, and we spontaneously stop at the most important ones as we become absorbed into that experience. And that happens by itself. We do not do anything for that. And this experience is always about ourselves, and we discover something about the disease, its cause, and our health. So even making the remedy becomes part of that experience, and you may see that guy with the mobile phone taking pictures. It's actually what happens when we make remedies. And imagine some painting may remind you the forgotten childhood dream, and it may become a life-changing experience actually. So such conscious provings, such remedy experiences, no matter how deep they are, usually do not last longer than 15 minutes. And then that experience, that actually sensations, they get into a repeated cycle, very much like ripples we get after we throw a stone into pond. And we get that splash, like first impression, it's pretty strong and very evident. And then we have ripples that fade slowly with gradually diminishing amplitude and increasing intervals. Compared to these two classical provings, we may see that classical provings are kind of compulsory, and they've been designed for material doses, like Hahnemann did with quina officinalis, or we do some proving of laxatives, let's say, in material doses. But here, remedy choice is not ours, and it's a natural in that way. So we usually get no splash, no first strong experience, except very rare occasions. And like this guy, you may sit here for days and get only some superficial and not healing experience, and that's not so safe and sometimes even dangerous. And that's why homeopaths do not utilize provings in their everyday practice. And what if we go through such provings with the patients? That means we have some revealing journey that lasts some half an hour and a half, or sometimes 2 hours, with several subsequent provings happening during consultation, and each remedy opening the doors to another one until the circle closes. So one remedy may open the fulcrum, which is the balance point between disease and symptoms. Another remedy may show the cause of the disease, like bringing some suppressed emotion to the surface. Then another may show a healthy side of disease in the levels of stillness that are opposite to sensations. Everything becomes suddenly still. And then totality may become evident. And totality is something that's always here and does not need any remedy. It's like divine and blissful experience you may get together with your patient. And then you may need some like rebalancing remedy, which would be grounding and establishing new balance, merging both ends of the journey to a circle. I paraphrase James Jealous, who was the inspirer of the present homeopathy, a wonderful osteopathic teacher who has passed this year. So the place beyond potencies, as one moves from remedy to remedy following the fulcrum, we arrive at the levels of activity where there are no inhalation nor exhalation periods. The living process is balanced. There is space, dynamic stillness, presence, and the movement of creation along with the physical sensation of eternity and love. So what's the outcome? Actually, we get thousands of deep and healing proving experiences with our patients each year, really thousands. And we also proceed till the circle closes at the end of consultation and treatment ends in wholeness. And our most important learning happens at these endpoints, like James Jealous called them. And instead of becoming experts, we feel like total beginners. We become empty and empty and empty. So even our relationship with remedies undergoes some subsequent paradigm changes until remedies become transparent and do not stand in the way anymore. So our practice shifts from being remedy orientated to simple, clear perception of ourselves, our patients, and life itself. When even if that happens through remedies. So homeopathy becomes present and blends with the life completely, and perception becomes transparent, as James Jealous said. It's very interesting that Hahnemann kind of knew that, speaking about the prover, practitioner being the prover. He said he will develop an understanding, appreciation of his own sensibilities, of his mode of thinking and emotions, which is the basis of all true wisdom. And I'm finishing already. Sorry for that technical disturbances. And actually, I want to quote one more teacher, Nisargadatta. Nisargadatta talked that knowing oneself is about fully knowing what you are not. Such knowledge is achievable and finite. And it's very, very interesting that remedies like mirrors, they help to glimpse us inside, explore everything up to what we may call the depths of the soul, but in no way we can find the explorer here. So revealing, and then it just, everything turns inside out. So revealing, so that then the revealing who you are really has no end. The more you reveal, the more is left to be revealed. And practice and life, they become infinite. So what we have is that homeopathy becomes whole. And besides its yang counterpart, and most of you are speaking about it, it's very intellectual, analytical, predictive, controllable. It's about data and knowledge and techniques. There is as big as that one. It's huge. It's yin counterpart. It's about our listening skills, about training them, about awareness, about revealing properties of remedies, about implementing provings into consultation practice. It's about levels of stillness that are as deep and as big as all the repertories you have. It's about the remedies becoming transparent and actually revealing the totality and our true self. And I think that this scientific homeopathy is both of it, both sides, and actually that yin side is a very special instrument, a very special tool for exploration of ourselves. And in chronic diseases, it's perhaps the most important tool we have. So thank you for attention.
Thank you, Dr. Simonas, for an excellent presentation. I invite Dr. George for his expert opinion.
Thank you, sir, for your presentation. This is something very new to, I think, our listening or understanding of homeopathy, the concept of connecting the yin and the yang. I think I would take like scientific homeopathy and the metaphysical part, which you have. I think this you're trying to connect these two things together. So it is a little difficult for proper comprehension at first glance, because most of these things are new to us. I think this needs to be explored. The only doubt I had was regarding the proving mode or how you implement in during your, what you told about consultation. So this is the only thing which I was not clear about.
Mhm. So,
How do you implement this proving mode in consultation? So proving, when we generally say about proving, we have a concept that's intervention in a healthy person. So this in a sick person, how do you implement this proving mode?
yeah, okay, a very good question, actually. Look. I'll try to answer it very quickly. Imagine a patient comes to you with a chronic case. So chronic case, it's not manifested usually. They come without symptoms. Let's say it doesn't hurt anywhere. Let's say it has some thyroid pathology or something. So they come not in a symptomatic phase. If they come in symptomatic phase, we use like normal homeopathy. We address the symptoms and we get amelioration. We get it in some 5 or 10 minutes. And then when we have some balance, we have no particular symptoms bothering, we may take some remedy set and go through it. Like I had it by my side. It's just Bach flowers, but we may take whatever remedy sets or classical remedies, etc. And we may go one by one. We test, we listen to the body reaction, and we go and we find the remedy that gives the deepest body reaction. But that deepest body reaction is actually, it's like proving, because you may get some tears flowing with some remedy. You can get fears, you can get some memories of past experiences, you may get some traumatic experiences, and many things happening. So
yeah, I could understand. Like you have a differentiation between the symptomatic and the non-symptomatic. So you have different approaches in both these type of cases.
yeah, because if we have symptomatic, it's okay to approach it symptomatic. But then when we get that balance, we may look what happens, and we may bring some deep impressions, deep seating impressions to the surface. So like I showed that picture, like it's like sitting on that tip of the iceberg and staring at the ocean while playing with the remedies. And with some remedy, you get something from the ocean. But all the experiences, and I had some maybe 10,000 or more such experiences, and I have never had experience from a remedy. It's always personal experiences. So what rises up is my patient's, but not the remedies. Okay. And that's all. That's simple. That's all about us. So we end up with the remedies like mirrors, and then we see ourselves in that mirrors. And then even the mirrors, there are no more mirrors. So remedies become kind of transparent, and they are just tools for seeing ourselves. And that's all. It's very simple, actually.
Thank you. I request the speakers to please restrict and adhere to your prescribed time. All the speakers are having 10 minutes. Next presentation is on new phase of practice and research by Dr. Gautam Arora.
I hope I am audible.
Yes, you are audible.
Good evening, senior brothers, and good evening, brethren all. Actually, the topic which I have taken up is, we can say it's a non-homeopathic topic, but a topic which is actually required for all of us since COVID has set in. We have been looking into, under the guidance of Sri Rabindranath Tagore ji, as open sessions under the tree and with nature. And Indian philosophy and Indian mythology has already always spoken about our dharamshalas and the mode of education. But presently what we are looking into is the digital media taking over with education. I like to just share some. So here, what we look into is improving education, practice, and research. We in no way can we improve the education, the practice of education, and the research which has already been around us by our seniors in a more sincere way, with paying due respects to them with every kind of education that they have given us, which has sharpened us our intellectual spheres. But we are looking into more of form of e-learning and computers and softwares and mobile phones being used for our education now. Now, no doubt, our education, by what I mean, our education is we ourselves are learning these skills and to impart the better education to people around or students around us. Uh, the pros and cons are many, but if we take up what was previously centuries of experience which we have been gone to, or was memorizing things, what we were exposed to as children, or what we were exposed to as more of theory based education, was memorizing things, which was the way education was imparted to us. Then what presently now is, we can say, is what we term as education 4.0. And 4.0 is not necessarily the fourth level of education, but then what evolution education has taken place is gradually over the years, as first memorization, then internet enabled learning, then consuming and producing knowledge. What we see is coding around us. The traditional education system, what we had were exposed to, was the students being awakened by the school bells and running around to the classrooms, and then being exposed to the teachers and the teacher imparting knowledge to all grouped together. But what we now come down to is our virtual library, the digital library, the social networking, the audio video library, and the teachers who have to be more on their feet and more up to the mark with regards to learning new skills which our children, or with this Gen X or the millennials, are already been born with. So we have to learn how to adapt to these newer modes of education, rather than the children being been been trained to, because they are already born with that. uh, Now, when we take up into the consideration the pros about it, children are, or even as teachers, we can set our virtual backgrounds and we can know wherever we want, we can take up the lectures from, and students also can appear, or say, for example, attend from wherever they want to. So anywhere, anytime is one advantage. Personalized learning, because the children are capable to learn in the most easiest way. They grasp very easily, and many times they were used to, or they were bored to in lectures, but here they're exposed to their mobile phones and internet. uh, they have to bring their own, like we say that BYOD is bringing your own devices. So herein they are more comfortable with the devices of learning. um, we can go on and on with regards to the pros and cons about the system of education that we will be exposed to, and we are now gradually we are evolving into what we are being compulsory forced to implement due to uh, the insecurity of um, the pandemic, which is prevailing since last 1.5 or 2 years. So here, when we talk about the education 4.0, we have the space which is transformed into the smallest place. The space is can be transformed into a virtual classroom. Um, the analysis or the assessment of kids become difficult when we talk about the virtual classroom, because if we take up the commonest problems that we face on in online learning, is first is the internet connection strength, as Dr. Patel, Dr. Manoj Patel, our senior professor, was asked by Dr. George Matthews about the connectivity issues, whether the students face that or not. Definitely, the students do face this connectivity issues, and therefore many times the camera has to be switched off to the bandwidth for the to support the lecture. Herein we have assessments which are conducted is also a query in itself, because uh, human error or human being is always tempted to cheat. That is a common human error that we are exposed to. With the if you even if you take a look into the temptation of the Adam's apple, that itself the temptation is always online, or temptation is always around us. So online security, bombings, internet bombings, monotony of lectures, we the human touch not being there, so every lecture tends to become monotonous. The advantages and disadvantages of online lectures, we have first is flexibility. If we talk about advantages, then we have individual attention, then we have appropriateness, anonymity, but then all of them, anonymity can give rise to dishonesty. So we don't know when our students say when they are logged in, we don't even know that they have logged in and they have already dozed off to their afternoon siesta or morning slumber. So again, advantages are student learner centered learning and accessibility. On the disadvantages with respect to or corresponding to that is quality concerns. We have minimalized socializing. Then the internet connection, like what we have spoken, dishonesty, minimal supervision, and challenges of everything that we look into. Some challenges which are faced by online education is technology. We are not well versed with technology. Then assessment and plagiarism, which we are commonest, which we face with lectures and notes being transmitted online and on the web, can be used to by scrupulous agents for their own good. Then we have benefits. We know we have already discussed, and pros and cons of digital devices in the classroom. Children not being attentive, or again it goes back to individual integrity that we are looking into. Uh, the general comparison of all the same topics that we have been discussed with, or what we have now discussed presently with. And ending out with this is that as educators, what we aim should be with should be of the students just not getting degrees, but also being educated by what we want them to be educated.
Thank you, Dr. Gautam Arora. I invite Dr. Josh Matthew for his comments.
I don't have any questions to you. I'll just make some observations. So what you have told, I think you have tried to bring forth clearly the paradigm shift which has happened from the Gurukula system of education which we had earlier and what we have as the digital mode of education nowadays. That difference is there, and very interesting to note the pros and cons on either side of the table which you gave. So for every pro there is a con. So it is balanced, we can say. So whether it is good or bad, it has to be again like very subjectively decided by the person who is using. And another thing I think you touched on was the digital divide. That is definitely existing in India. I think in a country like India, the digital divide is definitely there. So in online education, you have people who can use it, who have the ability to use it, and those who don't have the ability to use it. Even if resources are available online, there is this thing which the divide which can cause availability of resources to all on the same platform. So this is my observation. It was a good, interesting presentation, sir. Thank you.
Thank you, Dr. Gautam and Dr. Josh. May I now invite our next speaker, Dr. Shailendra, to present his study on perceiving the patient online.
Am I audible and visible?
You're audible as well as visible.
But I am unable to share the screen. Or is my screen visible to you?
It is already visible.
Okay, so I will begin with my presentation. Yeah. So, hi, this is Dr. Professor Shailendra Vaishampayan, and I'm going to touch a very, very important problem that every one of us are facing right now. How to perceive this biggest illusion of observing patients online? How to perceive a patient online? I think everybody in today's world, how do I expect my patient to give me appropriate data when I'm myself using this virtual background? There are lots of techniques like phones, angles, age enhancing softwares that makes us difficult to prescribe online. So this presentation will give you some hints how I use Johari and the concept of Gestalt to prescribe online in a better way. So we had a very nice life before this pandemic took place. We observed the patient, we examined, we perceived, and we managed the patient by using state-of-art softwares like HomePath, our own knowledge, our own learning. And finally, we arrived at a conclusion and we were able to work normally because so many things that we see in our clinic. In our clinic, we are the boss. The smell of the patient, sour smelling room, how can we forget that? So that is not available when we are working online. That's the biggest disadvantage of working online. And as I foresee, for many years, you need to work online from time to time. It's very difficult for us to, comprehend the methodology of working online. So what we are doing here, that when we see a patient, a stramonium patient, look at the boy. I'm sure out of 19 participants, 18 participants will think, okay, this is stramonium, ungovernable, destructive, violent, maybe abusive. When the stramonium boy comes into our office, our clinic, we clearly know how the stramonium looks. But online, it could be completely different. Just remember, stramonium wants light and company. They use brighter background. They make us wonder if the boy is at a problem or the parents are at the problem. So when we are dealing with the stramonium child. So this illusion created by this multimedia and by the Zoom meetings and everything. So how to conquer that? Because our previous learning was only limited to learning in 3 dimensions. A stramonium lady, similarly, you can see an old stramonium lady, but online, the background is different. The person may appear completely different. So how to overcome these biases? So this 3-dimensional image is left to a very hazy image for us. So there is a huge difference between seeing a picture of a tiger and a real tiger face to face. So we know the difference between seeing the patient experiencing the journey of case taking in our clinic and doing it on a virtual background. So there has to be a method. So I'm proposing use of 2 techniques. One is Johari window, second is Gestalt principles. So as like so many other Indian homeopaths, when we have a busy practice, so I have a CCTV in my office, in my waiting room. So whenever the patient is there in the CCTV, I observe them. Everybody knows this, and I observe their gestures because I know every patient will emit the remedy through their gestures. The way they look, the way they lift the glass, Varatram will do it elegantly. Phosphorus will be hazy and fidgety. So when we have this art of observation, which we have learned from our teachers from Calcutta, from Mumbai, everywhere, and we are using it, it's not a very difficult thing. But we need to teach our students and teach our fellow people a method, youngsters a method, how to create a formula to observe. So this is a concept of Johari window that we have used for many years in personality development, personal relationship. And this is the concept modified by me. Whenever we see something online on a screen, divide that into 4 parts. Part 1, known to the patient and known to you, like the person's symptoms. Second is sign and the background. The background, virtual background, use of color, use of fingers, fidgety feet, everything has to be observed because you have to rely more on your observation. In online consulting, the Johari window is completely distorted. And what we are left with is a background. But patient emits the remedy in the background. right? The patient will give you, he will definitely choose something. When he's working in the kitchen, he will tell you, okay, doctor, I am very innocent, I do not get angry. But when the children are dancing or interrupting, you see a very different image. So the whole image, the Johari concept, when learned properly, will give us idea about how to look at a person in frame and how to make notes of or objects plus the patient. And then we need to learn certain techniques of how our mind functions and how are we able to make a meaning out of those fragments. So this concept, just Gestalt concept, is a very famous concept used in marketing, designing everywhere in the world, all logos. So look at the figure here. The figure could be a zebra, or it could be just randomly drawn lines. But our mind is is an organized structure, and we unconsciously try to find a simple solution. So our learning online is different and offline is different. In offline, three-dimensional person, you can touch the patient, examine, look at the pulse, look at the temperature difference. Here, you just have an image, a two-dimensional image. There is a time when we will be virtually able to go into the patient's room in the next 5 years, I think so. But till that time, we have to rely on whatever is available. If you look at these images here, so these are like fragments in a photograph, an image in the background, the wall color, the paintings. So there are different individuals. When we see them differently, they are, performing some kind of meaningless jobs. But when we use the principles of Gestalt, these puzzles of Legoland become uniform, and we are definitely able to add some meaning and prescribe. So whenever we arrange them in a proper way, we create a beautiful orchestra. So this Gestalt principle, I would like you to learn on, and if there is a chance, I can speak about them at length because it's a huge topic. So we have our mind is organized structure, and we are conditioned to learn certain things in a certain way. So these principles will give us an idea about our prejudices and how to overcome them. So see the spare parts here. There are different spare parts. You could only construct a bicycle, right? You cannot construct something like a spectacle and an aeroplane like parachute, because we have to construct an image of a person. So the patient is emitting the remedy, the wristwatch that he is using, the glass of water that he is using, the way he's sitting, leaning forward, these everything could be explained easily with the Gestalt principles and Johari window, and you could prescribe a beautiful remedy and get results not exactly the way we get offline, because offline as a doctor, we have a lot of freedom. Here, we are sitting into patient's kitchen and sometimes in his bathroom and taking the case. So this is a very strange situation. So the concept is very similar to homeopathy. Summation of the whole is different than the parts. The fragmented part on patient's screen. There are so many fragmented parts, but one observes them and one learns how to observe and what not to observe. We will be definitely able to give a meaning. And I request all the senior doctors and teachers and international speakers, there is a need of creating a new materia medica, because the patient appearing online could be completely different than the patient appearing offline. So this is one of my favorite pictures here. So what we all see here? We definitely see a beautiful landscape where there is a small hamlet, there is a home, there is a well, and there are people. But are we able to see the same thing here when we are told what exactly it is? So this is what we see in patient's window, random figures. You could make it into a landscape, or you could make it into a human figure. We are here not to see the landscape. Our main purpose of online consulting is find out a remedy, a plan of treatment for the person. So there is a need of learning everything from the beginning for the students, and this is a new idea. I would request everybody to come forward with their own views, how they perceive, because last 2.5 years I am perceiving all the patients online most of the time, because you are not allowed to go to your clinic. Most so, this has an advantage and disadvantage. But when we are conditioned, when we are trained to see two-dimensional images and remedies, this, even if it is tilted, we see a man. So thank you so much. Thank you. This is my summation of the presentation. Thank you so much, everybody, Dr. Jawar Shah, LMHI, and the wonderful team and the seniors. Thank you.
Thank you, Professor Shailendra, for an exceptionally wonderful presentation. I invite Dr. George for his opinion.
This is an interesting new method. I think we have all come into the online mode now. So for taking cases, we need a lot of innovation in this. So, but one thing which we feel like, I also, when I sit in OPD, I feel that even now we have started OPD in Delhi. So we have a reluctance to touch the patient because he may be like, we keep a distance. Definitely we keep a distance. And so touching is like out of the way. So the problem is like, we are looking at cases like fever in a child. So we prescribe Sina or Belladonna or Arnica based on your temperature distribution of the body. So we are completely missing out on that. Even looking at the tongue, some people may find it odd to lower the mask and to tell them, they may like think why this is being asked. So this is one of the definite things which you have as a limitation when examination is needed in a case, especially if it is a chronic case, if it's a so if it is a pancreatitis or any such case where you need definite examination part, this is completely not like we can see certain things, we cannot see certain things, or we cannot experience our examination, we cannot come to the diagnosis based on our examination. So that is one limitation I think we definitely have, but this is something which we have to cope up. I think in the future, even if COVID goes away, I don't know how we will be proceeding, but we have to like develop new innovations. So in that way, I think both this Gestalt philosophy and the Johari window, which you have talked about, is an interesting thing which has to be explored further. Thank you for this good, interesting new presentation, innovative presentation. Thank you.
Thank you, sir. I would like to add one thing. I was part of a group who we saw around more than 400 patients in last 2 years in the hospital setup with Dr. Jawar Shah. And there are many, because you can't work alone. So we have seen these limitations, but when they were not allowing us inside, we could see a patient on ventilator and the ward boy was holding the camera. So we have not shy away from our seeing patients. Day one of COVID, and today we have examined all the patients because I'm a clinician. I can't just prescribe on assumptions and philosophies. I need to test the patient.
Yeah.
When there is no option, there are no options. Somebody in Delhi wants to see you, somebody in Kerala wants to see you. You have to adapt to the challenging time. And I would request teachers like you, Dr. Ishwarada, there are many stalwarts here. They could come up with different ideas and teach people how to prescribe online in a better way. Thank you so much.
Thank you, Professor Shailendra. I invite Dr. Anup Nigwekar to present his study on accreditation through standardization of caring process. Over to you, Dr. Anup.
Yeah, thanks for this opportunity. This is one very interesting topic and area of my active interest for the last few years, which I would like to share with all of you, is the process of accreditation and the need of standardization of processes. Because, all along I have believed that we all worked on minimum standards. And minimum standards don't fetch us any milestones that we need to achieve in our life. As a part of this process, I have launched actively into these areas of understanding how accreditations have to be looked at and how they can be actually implemented for excellence to be brought into homeopathic clinics as well as institutions that exists in India. This whole small presentation that I have is based on the active experience of actually attempting to implement processes of standardization and resulting accreditations at these three centers. The third center is still in process, but the other two have already got into their second cycle of accreditation as well. Having said that, what has been the process that was adopted? There's a need for every scientific system of therapeutics to have some style of standardization that has to be brought into the picture. Standardization is a process where one step follows the other, the second, the third, the fourth, the fifth, And each of these steps, when they are repeatedly attempted to be created and followed, what actually happens is that you start reducing your number of errors. And as these errors start reducing, your ability to making more and more correct additions starts evolving. And that is the very basic core of quality systems management. As we proceed ahead, what is the consequence that also needs to be looked at? One of the most important thing that all of us should be aware and we all pursue that we should be working upon is making people happy. All the presentations that have gone up so far are giving these levels of happiness to be reached by our efforts to your patients, to our physicians, our own selves, our students, and the whole lot of community that exists that we are actually addressing ourselves to as a part of being homeopaths. What did all this process bring about? As this slide attempts to share, it's a process of trying to organize what is my action, what are the issues in my action, how do I correct them, who is responsible to correct it, and with what timeline we need to get things corrected. Why is this important? It is important because a lot of statutory requirements in today's times are leveled at minimum standards. And most of us are happy with it. But now the changing trend of time is that we should show improvement. This improvement can't occur with individuals. It's a whole lot of team effort, a whole lot of training goes into it. And this training doesn't work upon itself. It has to be actually monitored. Therefore, these processes start getting important, gaining important. And as I share that slide with the 2 accreditation standards that are already available, it actually helps us to get ourselves organized and move in a direction where corrections of error is a process that we start learning with. We don't try to push things under the carpet and say the room is perfectly neat and clean. Because at the end of the day, the cost of poor quality is something that is phenomenal. Just imagine yourself traveling on an elevator and midway down the line, the ropes break off for whatever reasons of poor maintenance and you are into a fatal accident. These are all issues of poor quality. We all believe that things happened so far, things have not produced any issues in our life so far, so everything is fit and fine. We have identified varying elements that are actually put to force whenever you are interacting with our patients. There are multiple areas. We have identified nothing less than more than 150 points which can be actually monitored and tried to be corrected upon so that end of the day, the patient, the student, the physician, as well as the community at large end up with a happy feeling of the experience of having sought homeopathy. There are a number of evidences. This is one process which we are sharing, mapped over a period of 4 years time zones. You're trying to bring in patients for initial assessments. You are trying to bring about what happens when the patients are actually being treated by the physicians. This is a very simple thing, but something that is totally missed out. It's a legally very, very important phenomena. But most of us are so casual about this. Writing your name, writing the name of the prescription in capitals, signing off with the date and time, they are all carrying significances. As you see, a monitored trend changes towards improved trend. Then moves to the second phase of our people who are actually giving service to the patient. Absenteeism is one identified phenomena across the organizations across the world, which demonstrates that the person working in the establishment is not happy with the establishment. So we monitor that. The second point we also take care is the amount of concern that you demonstrate for people who work with you. All of us have gone through the COVID times, and all of us have realized that there's a need for each one takes care of the other. But if you are not monitoring whether the care has been actually being taken, we will not be having a healthy environment to work in. We have also another issue over here. As an example, we are doing labs. So many of you may have experienced testing of your own self. I am sure most of you have been very happy with your RT-PCR being negative, but there could be some reason in your mind which will just pick your brain. Was that negative or true negative, or was I hidden to be a positive but shown as a negative? This thought in mind makes people to redo their tests again and again. As a process, if I run a lab in my hospital, which is producing reports which are to be used by patients for their own clinical benefits and therapeutic management by physicians, the report that I share ought to be ensuring that I am delivering the perfection results that are desired out of me. Of course, this is not an easy task. A lot of training goes into minds because most of us are human driven. My boss tells me, I do it. So it's a person-driven life culture that we have. We have to shift it towards a system-driven life culture. There's a whole lot of time that is required in training of people, training of erroneous practices. In all, it is said that whatever has happened so far, it never caused a problem. So obviously it was right. Sorry, it may not have been the right, but simply since no one monitored and pinpointed that is an error, you happen to go scot-free. Inculcating values of documentation, so crucial for any scientific literature and or processes to be determined that you are making sense in what you're talking. There's a second thing that has been brought to our notice. But if I am but that anxiety in all of us prevents us from documenting things. It is something that we ought to learn, that if I am told that this was your error, it's an opportunity for me to improve myself. Cost in terms of financial resources. Yes, there is a cost. It is an essential cost because end of the day, we are creating an environment that's going to be safe for everyone who is receiving as well as taking homeopathic prescriptions is working in a safe environment. Monitoring. Most of us believe that monitoring may not be true. Very happy thing. I don't want a ghost of someone working on me. Team effort is very crucial, mandatory, and essential. There is also one phenomena that we ought to learn. Rome was never built in a day. Obviously, LMHI may have done a lot of reruns before they have actually implemented this show online for the first time. Systems management processes ensure moving from person to systems. We will never become error-free, please remember this, but we'll start minimizing the errors that we create. Most of the times, it is essential that we all should learn that to survive, we ought to remain fit. To remain fit, we have to ensure that we are exercising ourselves perpetually. I come to the closure of this with a simple statement that choosing accreditation as a method does ease our lives. And I believe strongly that will ensure longevity for homeopathy for sure. Thanks for this opportunity.
Thank you, Dr. Anu. I invite Dr. Josh for his expert opinion.
Thank you, sir. This was a very essential, I think, a pressing need, which you have touched on, the topic of accreditation. And because when you're looking at patient care, so the basic, the central point is the patient, and you're looking at patient care, and for that, the institution has to deliver. So for delivering, you need this accreditation, and for that, you have to put in all the effort and the infrastructure and all these things. About all the factors involved, the manpower involved, and all these things. So I think this can be like, I think in homeopathy, we can see now like the gold standard of NAC accreditation and NABH accreditation, all these things are coming into place, I think, as far as I think many of the colleges have gone into these steps to take these accreditations of NAC accreditation, and even in hospitals, you have this Kayakalp system where you have accreditation of the hospital. So it's a thing that people know that they have to be monitored, and that will definitely improve the functioning of the person and the hospital or the colleges as a whole. So that will definitely contribute to patient care. So that is what I feel. So here is something which leads to a performance audit. That is what I feel as a whole. If you can just take into account performance audit, that will place the individual and the whole community responsible for patient care. So this, I think, that has very clearly been conveyed in your presentation. Thank you, sir. It's good.
Thank you so much. Thank you so much.
Thank you. May I now invite Dr. Venkateshan Hariram to give us presentation on systematic review of homeopathic therapeutic trials.
Good day to one and all. Am I audible and slides visible?
Yes, sir. You may continue.
So, good day to all. I am here to present a research report done on the systematic review of homeopathic therapeutic trials published in peer-reviewed journals. Myself, Dr. Venkateshan, and my co-author is Dr. Sunny Matthew. We both are from Vinayaga Mission's Homeopathic Medical College and Hospital, Salem, Tamil Nadu, India. Just for an introduction, homeopathy is successfully being practiced over 80 countries, legally recognized in 42 countries. Amidst its high curative value, our system is continuously facing criticism regarding its scientific value. For example, I could give 2005 Lancet's article and 2015 Australian government's report and 2016 Nobel laureate Dr. V. Ramakrishnan's comment on homeopathy. Hence, it becomes important to verify the homeopathic system of medicine as an evidence-based medicine. Coming to the evidence-based medicine, its fundamental principle is to arrange hierarchically and grading the available medical research reports on the particular topic of interest. Oxford grading system have graded the different types of research reports according to the importance. Level 1A, highest being all the systematic review. So just this made us to go with a systematic review in homeopathy to review the scientificity of the homeopathy. Need for the study, many primary researches have been carried out globally and plentiful research results are published in various platforms, providing evidences. But on contrary, under secondary researches, very few systematic reviews are carried out in our field, and most of them were executed without proper understanding of the principles, so that they fail to highlight the efficacy. Primary objectives of our study are to compile and convey the efficacy of homeopathy through the scientific tool, the systematic review, and also critical reviewing of the published results. And also meta-analysis was planned according to the availability of the quality statistics. This study has been conducted during the years 2019 to 2021 at Vinayaga Mission's Homeopathic Medical College, Salem, India. And the protocol of the systematic review has been registered in the International Prospective Register of Systematic Reviews, Prospero. The dates and the details are given here. And the research question, which incorporates the PICO format, are as follows. The deceased patients, homeopathic treatment treated, controlled or uncontrolled trials, good, fair, or bad outcome. So all these PICO framework have been considered, and the primary aim was to evaluate the effectiveness of homeopathic treatment, accessing the therapeutic trials done on homeopathy with a good, fair, or bad outcome, irrespectively, which were published in peer-reviewed journals. The inclusion criteria fixed were both randomized and non-randomized control trials reports have been considered, controlled or uncontrolled, experimental or quasi-experimental, and also results published or presented at international conference proceedings also were considered. Trials with small samples, epidemiological trials, prophylactic trials, and retrospective studies were excluded from the study. And we had a time limit published reports just in last 10 years alone were just consulted. And according to the 5-point Oxford quality rating scale, the articles, the reports which scored 0 were eliminated because of the raw quality in their presentation. These are the keywords which we used for searching the studies, and these were the electronic databases and hard and soft copies of peer-reviewed journals which we have searched for isolating and detecting the quality therapeutic trial reports from all over the world. And this Prisma flow chart shows us that we have initially gathered 951 individual research reports which were screened according to the inclusion and exclusion criteria, and also they were screened for repetitions. So 733 such repetitions and excluded articles were excluded, and 218 articles which were being sent for the next step for full text reviewing. And after full text reviewing, only 75 trials which scored ZADAT scored 0, that is Oxford 5-point grading scale 0, have been eliminated at last. 143 quality research reports have been considered from 66 different journals which were being taken to the next level of reviewing. So this particular table shows us the split up of all the trial reports from different sources and databases. So this particular slide explains us about the 5-point Oxford quality rating scale, which mainly focused on the use of randomization, blinding, and withdrawal reporting in the research reports. So we found that 39 1-score articles and 18 2-scored articles and 31 3-scored and 26 4-scored and 29 5-scored. And we could able to see the green color numbers the reports are favoring towards the efficacy of homeopathy, and the red colored numbers which are against or which fails to give evidence for homeopathic efficacy. So 78 different diseases and conditions have been grouped under this 143. And since the systematic review can be done only if a particular disease condition is having more than 2 research reports under one category. So 99 reports were excluded, and 34 diseases, 17 reports have been identified with multiple studies. So this 99 reports under 34 diseases were manually analyzed with the following criteria to see the clinical and methodological heterogeneity, because systematic reviews aims at integrating the results of homogeneously studied reports alone. So these were the points which focused manually. Every report have been checked for this particular criteria, and then at last only 17 study reports and 8 disease conditions were found to be having no clinical or methodological heterogeneity, which were shown here, So depression, ADHD, asthma of children, BPH, cancer, essential hypertension, irritable bowel syndrome, rheumatoid arthritis. In cancer, it just the quality of life improvement was considered. So all these 17 reports were undergone for Cochrane risk of bias tool to eliminate any biased reportings. So the details are given in the abstract. It has been observed that 2 research reports on depression, 2 research reports on attention deficit hyperactivity disorder, 2 research reports on benign prostatic hypertrophy, 2 research reports on asthma of children, 2 researches done on cancer patients to improve the quality of life, 2 researchers on essential hypertension have been identified with quality reporting and also level 1B evidence according to the Oxford scale. And also it continues 2 studies on irritable bowel syndrome and 2 studies on rheumatoid arthritis. So this particular table shows us about the meta-analysis done on the above said 17 set of study reports. These things are given clear. And by performing the systematic review, finally, I could conclude that a good number of high quality homeopathic research reports have been published internationally. These can be considered as primary evidences. But on subgroup analysis, it is found that very limited reports are available. So this particular research gives evidence that to level 1A evidence according to the Oxford grading, scientific evidence for homeopathic efficacy in the treatment of depression, benign prostatic hypertrophy, essential hypertension, and quality of life improvement in cancer patients are given. So I sincerely thank one and all for this opportunity. Thank you one and all for this.
Thank you, Dr. Venkatesan. I request our chair to give his opinion.
Thank you, sir. I think this is, one of a kind study, intense study. You have gone like eliminating, like by eliminational study coming down to 17 and then coming down to like very few. So in search of quality in our therapeutic trials. So it's definitely a very rewarding experience. And I think that will enlighten the whole community regarding more, the importance of more systematic reviews and in our homeopathic field, especially in the therapeutic field. Thank you.
Thank you very much, sir.
Thank you. Ms. Robin Pollock to come up with the presentation.
Yes, hi. Let me just get it ready. Hi there, everybody. Okay. So you're good. You can see everything, yeah?
Right.
Excellent. Okay. So today I'm going to talk about the importance for us as homeopaths to embrace the technology that is available to us now to establish and grow our practices, and which we would be really wise to embrace or we will be left behind. So let's see how far we've come by having a glance at the past. Here we see in 1817, the Symptomen Lexicon was Hahnemann's second attempt at constructing an index. The first one was in 1805 in his Fragmenta de Viribus. So here he pasted paper strips.
Excuse me, ma'am, your screen is not visible.
Oh, I didn't share the screen, you're right.
Yeah.
It's visible, excellent. So good, because I want you to see the paper strips, because it's really kind of cool, right? Because here he had to cut these paper strips, and there were slits to hold the strips in place, and he had to cut off the corners, and he could take them in and out. So this was hardly a clever use of technology of the day, but by today's standards, it was pretty cumbersome and inefficient, but it was still remarkably innovative and practical. So repertories have continued to be published in massive volumes. And of course, they're still quite cumbersome because you have to go through them page by page, paragraph by paragraph. There's no Control F or find function. So everything you're looking for has to be found in a quite cumbersome way. So let's go now forward to the computer age. I just want to say that I've been asked to cut my talk from 15 to 10 minutes, so I might be rushing through a bit, and I apologize for that. So in the 1980s, the power of computers and how they could be used by homeopathy became evident to a few high-tech minded homeopaths. Now, I've always considered homeopathy and technology, computer technology, to be a match made in heaven, because the ability of the computer to take huge sets of data and arrange it any way you want is just so perfect for homeopathy. So here are some of our pioneers: Dr. Schroyens, Dave Workington, Dr. Shaw, Professor Vitulkas, and of course, Roger van Zandvoort. So we have advanced technology in all our repertories and our materia medicas, but when it comes to how we find and treat patients, we're really quite stuck in our thinking. So let's zoom forward about 40 years since the first computerized repertory, and we note that very little has occurred on the technology front in homeopathy during that time. So to a great extent, we've not taken advantage of the absolute explosion in advances that have been made. Now, that's not to say that nothing online exists, it's just that not too many people are aware of it, or if they are, they don't fully comprehend the implications of it. But the reality is that today people are completely digitized with high-speed internet, computers, tablets, and smartphones, and patients are increasingly researching and finding their doctors on their devices. People are now used to seeing their healthcare providers online, and this will likely continue due to its convenience. So it's critical for us to keep up with the times and provide the means for patients to both find and be treated by us online. So a great solution for homeopathic clinicians is something called a telemedicine platform. So a telemedicine platform isn't just a website. We all have one. It is in Zoom. Many of us are seeing our patients currently during the pandemic this way. It is actually a complete healthcare platform that incorporates a personalized website, patient care management, file storage, remedy distribution, and accounting services. So it's really an all-in-one office. So let's have a quick look at the global telemedicine market, which is now currently at about 42 billion. Is it even worth it for us to invest in a telemedicine platform? And the answer is yes, because it's estimated that within 5 years that it will explode up to $400 billion a year. So it's only going to grow, and it really makes sense for us to get in on the ground floor, then take an elevator up years from now. So if we were to create a complete telemedicine platform, what would practitioners expect of it? What do homeopaths want? Well, we're not just clinicians. We have to acknowledge that we're also a business. So we want to grow our practice and make a real living. Online marketing means more patients from anywhere in the world. More patients means greater income. People want to recoup their investment after just a few patients. They want a one-stop solution that handles everything. So this represents the difference between a do-it-yourself and a one-stop solution. So renovating a room, like in the before picture, involves a large number of experts. You can imagine you're going to need someone for the drywall. You're going to need somebody to make wood floors for you. You're going to need a designer. You're going to need an electrician. So this all requires time, money, and expertise. And if we want to do it ourselves, it requires know-how, which many of us don't have. So if we look on the right, the building a healthcare platform requires a number of experts, someone to design every page so you can populate your own website, someone to create a patient module, to create an integrated office in one place, someone to do the accounting for your bills, and even an in-house pharmacy to send remedies around the world. So it's far more convenient to be in the after picture than in the before picture, because everything is in place, everything is included, and ideally everything is affordable. Now, people want to be able to customize their own personal websites. You want to choose your own domain name. You don't want to be affiliated to the platform. You want it to be really your own place. Use their own clinic's name and add their photo and logo. They want to choose a design theme from an available selection. They want to provide a personal profile and clinical specialties. And they want to be able to post patient testimonials and successful cases. Now here, they also want to create a health plan fee structure for patients around the world. Now, what does that mean? So you can choose to provide one service for one fee, as you already likely do, or you can create a fee schedule for, let's say, 1 month, 3 months, a year, 2 years, and you get paid that amount whether you see the patient or not. It's akin to a lawyer being on retainer. You want to be able to add links to your social media, and you want to be able to do it easily, because I know from my own original website, it was a nightmare to get that done. And then add photos to personalize their website. So you want to stand out from other websites, and the more a potential patient can learn about you and feel connected to you, the greater the likelihood that they will choose you as their physician. So things like photos of received an award, webinars that you've given, or papers that you've published, these all help to create a connection. So I happened to join a platform recently where I was allowed to do all of these things. And I'm decided to present the details about it, how to use this technology, because many people are technophobic and they resist change because they have a self-belief that it's too complicated to learn a new system. So just to show you quickly how simple it is to go through this, here is a dashboard with all of the customizable elements I just mentioned. You only have to click on each one individually and fill in pre-made templates. So they had 13 templates for me to choose on. My favorite color is red. So this is my website, and you'll see I could put my picture in. This is the name of my clinic, Harmonious Homeopathy. Here's my logo. Here are my credentials, etc. And there's more to this page. This is all I could fit in. And here, if you go to profile and specialties, all I did was cut and paste it. Copy and paste from my biography that I already had on another document, and it was already populated in 3 seconds. Social following, as I said, the social media, all you have to do is put in your URLs, your phone number, it's already done, taken care of for you. So now you've got your website, and that's as far as most of us have gotten, but we have to market ourselves so that our websites are clicked on. And that's where many practitioners are stuck because they just don't know how to do this. So you need help with marketing. You want to be provided with creative materials that can instantly be uploaded to all social media. You want personalized marketing materials with the clinic name, the URL, the clinic address, and contact details. So literally within an hour of me joining up with this platform, I was sent my first piece of marketing. I was encouraged to paste it to all my social media. Here's the name of my domain, here's my phone number, etc. If I want to add my clinic name, if I want to add my logo, all I have to do is ask. There will be webinars given to the doctors in order to learn how to do marketing. And my understanding also is that the ads will be given to you according to the season or the circumstance in the world. So for example, if it's flu season, you'll get marketing related to flu. If it's the new school year, you'll get marketing related to, let's say, school anxiety in your children. So it's very targeted to a specific time and place. Now, we just discussed how the platform handles the clinician's advertising needs. The beauty of a platform is that there's also a complete office suite right there online to organize anything and everything to do with your patients. So you want to maintain a contact list, you want to be able to send the history form, keep a record of all your emails, manage the patients from a dashboard, bill and keep track of earnings in multiple currencies. So you bill the patient and the platform takes care of all the accountancy work. Store all your records in unlimited encrypted cloud storage space. And wouldn't it be great if you had a pharmacy where you can actually send medicines to patients anywhere in the world? So again, I'm going to just rush through this. So this is what the patient list looks like, and you can see the dashboard on the left. If I want to see the patient's intake form, I press here. If I want to see the dashboard, I press there. And this is what you get. This is the case history form, which you can then upload over here. You can upload all your patients, let's say x-rays, test results, whatever. You can actually use that intake form for new practitioners or students. This is perfect. If they haven't really crystallized their intake questionnaire, they can actually use this and use that as their intake questionnaire. So all the information you're going to need from your patient is listed over here. And this is an example of a doctor who has seen a bunch of follow-ups. And anything that you want to see about the patient, you can even see their thermals. You can see, if you just want to see at a click of a button, you can see their generals, their thermals, their mental emotionals, everything is there. This is the name of the doctor. And over here, we see that there's been an assigned doctor. So I'm going to talk about that now in terms of support. Of course, you're going to want technological support because you want in-house timely and knowledgeable staff for website operations. You have a technical glitch, you just put in a request. Social media handholding, as we talked about. And on the homeopathic front, you're going to want mentorship from other doctors for difficult cases and follow-ups. And that's why there was that other doctor listed there, because this doctor asked for help with prescribing, with understanding the case, whatever. Once you become part of this platform, you're now part of a community where you can actually reach out to each other. You have colleagues to cover your cases if you have to be away. And there's the pharmacy for quick dispatch of quality medicines. So this is our new normal. Telemedicine is the wave of the future in our quickly evolving digital world, and the pandemic made the benefits of online services utterly self-evident. So what are the benefits then to our patients? So let's look at just a few examples. Obviously, the elderly to not have to leave the home. Let's say they've broken a hip. Let's say it's icy outside. Let's say they have to take an expensive cab. This would be a tremendous benefit to them. There's zero travel time. Let's say you're too sick to come in. The irony of being sick is that you have to get out of your nice warm bed and go to a doctor's office, or you have to bring your germs with you and share it with everybody in the waiting room. Now you don't have to do that. There's less time lost. Patients can schedule their appointments in the middle of their workday without having to leave their home. There's no commute time. There's no waiting in the office. And if the doctor is late online, all you have to do is keep working at your desk until they come on. So obviously it's utterly convenient. But you say, I'm already doing telemedicine. I'm seeing patients online. Well, simply seeing our patients on Zoom is not enough anymore. If you have no marketing skills and materials, you will not be found. Without a coordinated healthcare platform, you will continue to work alone and without support. And it is a huge time saver because an established healthcare medicine website takes care of all the repetitive office tasks, freeing up valuable time. So we need to start thinking globally. Market ourselves online and attract potential patients, see patients from anywhere in the world, develop relationships with new colleagues anywhere in the world, receive support from fellow homeopaths, and actually give back in time. You can be a mentor just like you can be mentored. Telemedicine develops a strong, committed, harmonious worldwide homeopathic network. I want to thank LMHI Liga for giving me the opportunity to speak today, Dr. Jawar Shah. And I'm finished for today. Thank you very much.
Thank you, Ms. Robin, for an excellent presentation on holographic proving and telemedicine. And I thank you for completing it on time. I invite our chair for the final concluding remarks.
Your presentation was a eye-opener into the immense scope and potential of homeopathy in telemedicine, the nitty-gritties of all the case, how do you handle a patient online, that was very clearly mentioned. It is a very clear-cut guidelines are there. Thank you.
Thank you very much.
We have to conclude our session here. I don't think we have the last speaker. Has he joined, coordinators?
No, ma'am.
Okay, so we shall conclude our session, and I express my sincere gratitude to the learned chair, Dr. George Matthew, and all the presenters who have done a wonderful presentation. Thank you to the coordinators and organizers for a good evening. I request everybody to move to Hall 1 for the finale and concluding ceremony. Before that, if we could have a quick photography session.
Yes, I was about to say that. Thank you, Dr. Anu. So technical team, could you just click a picture of all of us to just capture this wonderful presentation and memory for all of us?
Yeah, sure, ma'am.
Please let me know once you're done.
Please, everyone, open your camera.
Please, could you open your cameras so that we see you? Thank you all for such an insightful presentation, and may you all have a good day ahead. Thank you so much.